Ciao, my name is Vito Cantisani. I'm Honorary Secretary of EFSUMB, CEUSB Ultrasound Society of Italy President, Editor of Ultrasound, and Professor in Radiology at University Sapienza in Rome. It is my really great pleasure today to be the chairman of this webinar. Today we will discuss on CEUS in non-abdominal organs. And I'm very proud, and I have the privilege to introduce and to present to all of you three very well distinguished experts from China. Most of you know that I have a very good relationship with China. We started our cooperation 10 years ago, and we are increasing every year, exchanging ideas, promoting our service, and putting together ideas, knowledge, and expertise. The first speaker is Professor WenLuo. She works in ultrasound department, Seeing Hospital Air Force Military Medical University. She was a visiting scholar at Yokohama City University, Japan, Deputy Yacht Director of Musculoskeletal Ultrasound Professional Committee of Chinese Society of Ultrasonic Medical Engineering, and Deputy Yacht Director of Shanxi Province Society of Ultrasonic Medical Engineering. She has been longly committed to clinical application and research on tumor contrast enhanced ultrasound diagnosis and intervention ablation. And today, she will provide to us her experience showing what is the value of CEUS application in thyroid disease. Please, WenLuo, you have time to present your presentation. At the end of it, I will ask you some questions provided by the participants. I would like to ask all the participants to send their questions by chat, and then I will provide them to the speakers to have, to all of you, the knowledge. I wish you good, fruitful webinar. Please, Professor WenLuo, it's your time.
Thank you for Mr. Chairman. I'm honored to have the chance on this special occasion. My topic is evaluation of the characteristics of thyroid nodules on contrast-enhanced ultrasonography, a retrospective study. My name is Luo Wen from the Department of Ultrasound, first affiliated hospital in Air Force Medical University in Xi'an, China. Last year, it was published in the Nature Review of Endocrinology that from 1990 to 2013, the global age standardized incidence rate of the thyroid cancer increased by 20%. We can see in this map, in some areas of the North American, some countries in Europe, in China, Australia, the incidence rate of the thyroid cancer is in a high level. With the increased number of the thyroid nodules, the differential diagnosis of thyroid nodules become more and more crucial, but it still remains challenging. Based on the thyroid imaging reporting and data system, hypoechoic microcalcification, irregular margins, and taller than white on grayscale ultrasound are considered to be related to malignancy. But we know in clinical practice, sometimes the image of the grayscale ultrasound were greatly influenced by the diffuse change or some inflammatory factors. In a clinical practice, sometimes we meet such a case. There is a hypoechoic nodule. It was classified as a Terrace 5, but just after the surgery, it was confirmed as a nodular goiter. Before the surgery, we performed the contrast-enhanced ultrasonography. We can see on the CEUS there were just a few vessels within the nodule, and with a clear margin. It was verified this nodule was a necrotic nodule. So to be or not to be, it's really a hard question. Using the intravenous injection of microbubble contrast agent, CEUS can depict the distribution of vascularity in focal areas, and it has been reported for identify tumors in solid organs, including liver, kidney, or uterus. However, enhancement patterns of thyroid nodules on CEUS have been described from the different perspectives in the current literature. So, in this study, we aim to evaluate the features of thyroid nodules on CEUS and detect the association between the CEUS findings and histological results. Based on the clinical experience in our institution, we reviewed the CEUS results of the nodules in 2 years. It is expected more useful information will be investigated for the differentiating thyroid nodules. We reviewed the patient from July 2014 to July 2016. The nodules in 252 patients were included. That is, we focused the most suspicious nodule in each patient. The final diagnosis was confirmed by the pathology after surgery or cytology. Ultrasound equipment, my lab Nandi with the linear array probe were used. Contrast agent sonoview was injected from the forearm vein, followed with a 5 milliliter saline. After the injection, the thinning loops from the 0 to 90 seconds were stored. For the image analysis, the enhancements on the CEUS images were evaluated as the following 7 patterns: concentric hypoenhancement, heterogeneous hypoenhancement, hypoenhancement with sharp margin, homogeneous hypo-or-iso enhancement, island-like enhancement, homogeneous hypo-iso enhancement with ring-like surrounding vascularity, no porphyrin. Next, I will describe the 7 patterns in detail. This is a hypoechoic nodule with irregular margin. On CEUS, after injecting the macrobubbles, it was detected that there is a hypoenhancement area, and it became smaller and smaller. So this pattern was described as a concentric hypoenhancement. After surgery, it was confirmed as a papillary carcinoma. This is another hypoechoic nodule with an irregular margin. On the CEUS, after injecting, the nodule was enhanced equal to the surrounding areas and without the margin. So this pattern was called iso enhancement. After the surgery, it was also thyroid papillary carcinoma. This is a nodule containing the isoechoic and anechoic areas. On CEUS, we can see some part was iso-enhanced and some part with no porphyrin. And this pattern like the island and the lake. So we called it island-like enhancement. After the surgery, it was a nodular gutter. This is an echoic nodule with a regular shape. After injecting the macro bubbles, the nodule enhanced immediately and with obvious ring-like vascularity. After the surgery, it was a nodular goiter. And this one is also a hypoechoic nodule. On the CEUS, we can see there is no perfusion and or just a few perfusion and with a sharp margin. So this pattern called hypoenhancement with sharp margin, and after surgery, it was a nodular goiter. This is a hypoechoic nodule with irregular margin. How about the contrast-enhanced ultrasonography? It was detected that it was enhanced, hypoenhanced, but heterogeneously. So it was described as a heterogeneous hypoenhancement, but not the concentric hypoenhancement. It was also confirmed as the thyroid granuloma. This one containing the isoechoic and anechoic areas. How about the contrast enhanced? We can see there were not any macro bubbles within the nodule. And this pattern, we called it no perfusion. And after surgery, it was also verified as the nodular goiter. So this is the 7 image patterns. And among the 178 malignant nodule, we can detect that concentric hypoenhancement, heterogeneous hypoenhancement, and also the hypoisoenhancement occupied the most of the part of the malignant nodules. For the benign nodules, the hypoenhancement with sharp margin and the hypo or iso enhancement with ring-like vascularity and island-like enhancement and no perfusion occupied the most part of the benign nodules. And we calculate the sensitivity, specificity, and positive predictive value of each dominant pattern. And we find for the specificity, these patterns yield the high specificity, but the sensitivity were low. Then we combining the 3 enhancement patterns related to the malignancy. We know is the concentric hypoenhancement, heterogeneous hypoenhancement, or the iso enhancement. Yielded the diagnostic sensitivity of the 97%, specificity of the 71%, and the PPV of the 89.2%. When we combine the 4 enhancement patterns which related to the benign nodules, it yielded the diagnostic sensitivity of the 71%, specificity of the 97%, and the PPV of the 92%. So concentric hypoenhancement was the most common pattern in the malignant nodules. And 1/3 of the malignant nodules were depicted with iso enhancement. And on the other hand, the majority of the nodules with iso enhancement were confirmed to be malignant in this study, which is a little bit different from the results of the previous literature. And the hypo and or iso enhancement in benign nodules was always associated with a vascular ring which is different from the SO enhancement in the malignancy. The island-like enhancement and the hypoenhancement with sharp margin patterns mostly occurred in the nodular gutter. Before, hypoenhancement was used for the diagnosis of malignancy in the previous literature. We describe the hypoenhancement in detail as a concentric hypoenhancement, hypoenhancement with sharp margin, and heterogeneous hypoenhancement. However, we detected that hypoenhancement with sharp margin always occurred in the necrotic, cystic, and inflammatory nodules or nodular gutter. It's different from other hypoenhancement. There were also 10 nodules with a final diagnosis of inflammatory changes. 5 enhancement patterns of them: heterogeneous hypoenhancement, concentric hypoenhancement, hypoenhancement with sharp margin, iso-enhancement, and iso-enhancement with ring-like vascularity. So it was detected that various patterns may occur for the inflammatory nodules. And in this study, we just have 10 nodules. It was a small amount. And we hope in the future we can collect it more and more inflammatory nodules, and we can find the dominant pattern for them. So in conclusion, we describe the different patterns encountered in thyroid nodules on CEUS that reflect the differences in the distribution of vascularity. The concentric hypoenhancement pattern typified the largest percent of the malignant nodule, but heterogeneous hypoenhancement and iso-enhancement could not be ignored. For the CEUS, it was a potential important tool for the differential diagnosis of the thyroid nodules, which can avoid unnecessary surgery or biopsy. That's all. Thank you.
You did provide your great experience in that. I haven't seen any questions from the audience, but as you know, we recently published our EFSUMB guidelines, and according to our data, we did not suggest CEUS for characterization of nodules, although this is a research field, very active research field. In your experience, do you use daily CEUS or elasto or both to increase characterization of thyroid nodule?
Thank you for your question. In China, there are many patients with thyroid nodules, and some patients become anxiety, become anxious of these nodules, and someone choose the FNA, fine needle aspiration, directly. In our experience, we use the CEUS and find many patients with nodules, just benign nodules, and the clinical doctors also give the belief on the CEUS, and we feel that CEUS can help the clinical doctors or the patients to have the useful information and select some benign nodules from the malignancy nodules. So we find even it cannot classify all the categories, but we still find it's helpful to give some useful information for the clinical management.
Okay. 谢谢. Thank you.
Thank you.